Next we actually have a joint talk with two speakers. And I guess the first one is Dr. John Pawlovich. John Pawlovich is a family physician for over 25 years of clinical service. He really focuses on remote, underserved communities across the province. And then joining him will be Sandy Lee. So Sandy also has quite a significant experience in healthcare and public policy, and she is currently the leading senior project manager for the drone transport initiative. She'll be heading this work, and so they will be talking about the drone delivery transport for the medical supply chain. So welcome.
Thanks, Hong. So just so we're getting the slides, thanks so much, John Pawlovich here, Rural Family Doc. Sit as a UBC Chair in Rural Health, and as Hong alluded to, Sandy and I are going to just share a little story about some work we've been doing that started over the COVID era to really dig into how we could positively influence the medical supply chain for underserviced communities. Okay, so this is a little bit of a departure from everything we heard this morning, but it has relevance in that blood is kind of an overarching theme here. And I should acknowledge we're here at the behest of Ed. Thanks so much, Ed. And you probably don't get many family docs coming to speak here, but I think you'll appreciate some of the similarities of what you've been speaking of this morning and what we're going to talk about a little bit right now. So I just want to acknowledge the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh, which we find ourselves. This is a picture of the Slatin First Nation, which is up in north central BC. And so, as alluded to, my 30 years of medical practice have been exclusively in the northern half of this province. And so this picture could be anywhere in Canada. It could be a lot of places in the world. This is Tackle Landing. It's a very remote community in north central BC. And the reason I show it is because the relevance of a remote community like this has everything to do with the kind of work that we're trying to achieve here. Nothing comes in or out of this community easily, including people or medical supplies. There's no pharmacy, there's no lab, there's no grocery store. If you're sick, transport's a long ways away. And these are two pictures that I took of patients in this community over the last 15 years. And the reason I show it is because these patients are extremely sick. They are in need of things like blood. They're in need of medicines. And so neither of which are in either in any supply or in large supplies. And in particular, in the top right corner, I've got two young, very keen and capable learners from UBC. One's a pediatric resident. One's was a family practice resident who's now an emergency room physician. And then we have our emergency response team that's come up. It's really interesting when you take learners and colleagues who have predominantly worked in an urban setting such as this, and you put them in a community such as Takla, and then you have a sick patient that could be anywhere. The sick patient could be at VGH or here at St. Paul's, but they were in Takla, and you realize how alone you are. And you realize that you can't do things that you would customarily do. And most people who train in urban settings never experience what it's like to be in an environment where they don't have an endless supply of everything. Manpower, medications, blood. Just think about the last time that you asked for something and somebody came back and says, we don't have any, or we only have one vial of that. And this is the frustrating part. And so the patient on the right couldn't be intubated because I didn't have enough medicine to sedate them and paralyze them for the 14 hours that it takes for transport to come. And so transport times are shockingly long. The patient on the left had a hemopneumothorax that needed blood as well, no blood available. So both patients survived, but the question is, how do we do better? And so our province is very diverse. For the people that are out of our British Columbia here or out of the country, the top half is what we're talking about here in Northern Health. It's about the size of France. And our province is not unlike a lot of other provinces in our country. The population is all skewed way down in the southwest corner of the province. And if you look at our country, again, it's heavily skewed, about 160K from the border. The vast majority of our population lives. And then everything north is sparsely populated. Resources are poor, and people are really challenged to access medical services. So this was a project that we initiated during the time of COVID, which arguably is pretty notable. What we did was we had two communities, the Stellatan First Nation and the village of Fraser Lake. These communities aren't separated by any heroic distance, but this wasn't about how far can we go with a drone. This was to set up a feasibility study to understand what needs to be considered, particularly on the community end of how you implement this in a partnership, co-creative way. You don't want to do things to communities, you want to do things with communities. And First Nations communities certainly, and Indigenous communities around the world, of course, have had too many things done to them. So what we did was we set up this 12-month drone project in COVID. And for those of you who don't know anything about going, who here has been to a reserve in Canada? So very, very few of you. So during COVID, this is Stellatan First Nation. The road was closed. Nothing went in, nothing went out. That was the same for Indigenous communities across our country and in Australia, New Zealand, and other places. And so, and luckily we were doing virtual health at the time. I could order a COVID test. I just couldn't do anything with the COVID test. So it was essentially useless. So we started this project where the drone went back and forth between Stellatan and Fraser Lake. We did over 1,200 flights. What we started to do and what we ended up doing at the end of 12 months was a 4-season project, brutal Northern Canadian winter. We learned a lot about the shortfalls of technology. So there were some really interesting learnings about this that I could go on. But understanding that commercial drones are regulated by Transport Canada, knowing that we have regulators in pharmacy, we have the diagnostic accreditation program if we're going to, delve into the laboratory side of things. So lots to consider. So I'm going to turn it over to Sandy. She's going to tell you a little bit more about the nitty-gritty as well as where to from here. Thanks, Sandy.
Thanks. Hi, everybody. My name is Sandy Lee. Not a scientist. Not a physician, but so I kind of lead the partnership with this work. And I think what John has shared is really the foundation of this work is partnership. And what we learned from this project is there's a lot of basic science, there's a lot of research that happens, and there's a lot of innovation that happens. But when it comes to implementation into a rural context, there's a bit of a challenge when it comes to return on profits and those type of things, and making it particularly challenging for us to implement this work. So UBC Faculty of Medicine, where I work, kind of came together and started building out a research team to help respond to this need. We kind of see this as a convergent science where it's a opportunity to implement innovation, implement partnership with everybody that we work with. So we formed a research cluster at the university that includes people from laboratory sciences, folks from implementation science, from health economics, pharmacy, health outcomes, as well as our engineering team that is helping us with the next phase of this work. In addition to all of the partners that we worked with in phase 1, we've now also expanded our reach into expanding to other nations in the area, as well as partnerships across our healthcare system. So we have now worked with the ministry, we work with the PHSA in developing this work, RCCBC, the Rural Coordination Centre of BC, and also have ongoing conversations with CBS, which is probably why we're here, and a number of other organizations. So to give you a sense, we are planning for the next phase of this DTI project with all of our partners, and we're continuing to build up our research team who are interested in this work. And as John mentioned, this work is really foundationally about communities, and so we move forward with the plans of this work with community, identifying what those priorities are, having them involved in each step of the conversation. Furthermore, I think what we've also learned from this project is that drone can transport essentially anything. So our purpose here is to really build out a model that it can transport the most challenging items. That could be blood products, that could be laboratory samples, those could be vaccines. And so then we're here building this out and trying to reach the most isolated communities, which means that we need to work with transport regulators, with airports, and also engineers and private sector drone companies to build out technology that could reach isolated communities that have no connectivity. And so our next phase, we do have a number of research themes that are coming out of this work. As mentioned, this is messy partnership and there's a lot of partners involved. So implementation science on knowing how to scale this work is very important for us, because we know that even though if it works here, if we're unable to scale, it'll be challenging. Secondly, we'll continue our pharmacy work. John has been working very closely with virtual health services in the province, and so right now we are working with the pharmaceutical science faculty to build out some virtual pharmacy support that can now join some of the provincial platforms. The work that we're also doing includes ongoing laboratory medical supply delivery, and then more importantly, and also very importantly, is also designing drone technology that works for the Canadian North. So for information, Rwanda has transported blood products. There's all these countries that have done this work. What makes this project is a little bit different than those is that we work in a much more strict regulatory space in terms of the density of our airspace. We also have very cold winters and also hot summers that are probably similar to some of these African countries. So the technology is also an important component, which is why this is a joint faculty initiative. So, I skipped a slide. This is a drone that we're using. So just for your information, our project received some funding announcement recently, and so we have secured $2.8 million of funding for this project. We're still closing some of the gaps with our funding, and a lot of this all comes from aviation innovation funding that is focused on development of the aviation, and then smaller portions of the funds are towards the healthcare research component. And so this type of work is quite expensive. We are using this drone right here to give you a sense. The wingspan is 3.5 meters long, so almost double my height. This drone has already been used by our Faculty of Applied Science Department. They also have tested hydrogen fuel cell on this drone, extending its flight distance by 2 or 3 times. This is a fairly small drone, and so transport, as of this late March, Transport Canada announced new policies, meaning that medium-sized drones are permissible in Canadian airspace. So what that means is drones up to 150 kg are now available for us to be used. This is on the smaller end of that 150 kg range, and can fly up to almost 200 plus kilometer distance with the hydrogen fuel cell. And so going back to our narrative, we are working with our communities to do this work. Still Island First Nation has been a huge support of this project and throughout, and been very patient with us as we build out the necessary work to make this a possibility for their nation and other rural nations. As you can see, Stella is actually right along Highway 16. So this blue line is Highway 16, also known as the Highway of Tears of the murder and missing Indigenous women. And we are building out some work with developing a network delivery so we could share resources between multiple communities, as well as there will be a juncture within the Prince George Airport that we have established a partnership with, where we deliver products from a lot of things come from Vancouver to Prince George, and then Prince George to the nearby hospital, and then kind of ping pong our way to the communities. And so these are some preliminary plans that we have. So back to the blood narrative, based on some of our initial conversations with Canadian Blood Services, we did a bit of review of their blood supply distribution in the province. And just to give a sense of kind of the health inequity that exists geographically, what we found was that once we adjusted per capita, there was probably 1 blood product to 3 blood products from the north versus down in the lower mainland. And so I think that kind of just reflects how often, although even when we adjust for the population size, there is a great difference between access for communities based on where they're located. So, yeah, and so we have a whole bunch of other healthcare application that extends beyond what we just discussed. And so before I kind of wrap up, I want to share a little bit about just the community voices. I think we mentioned that this project is focused on community narrative, focused on community needs, and I think it's kind of challenging to bring our community members to join us on every presentation we have. And so we developed this video to share a little bit more from the community perspective of the work that we're doing.
Right from the outset, when the project was first announced and discussed, we started having it being a part of the community, having the devices to bring them their prescription.
The UBC Drone Transport Initiative is really a partnership project that embeds drone technology into the healthcare system.
The roads are not paved. There's hardly any traffic going in and out. And so a drone would, oh God, that would help so many people. Now I don't have to worry about getting my medicine. Now it comes to me.
The drone and the telehealth helps have community members stay at home, and that's a big thing. It provides that service that where they can come to a health center that they understand and see the doctor.
It was an ideal project to bring youth in and have youth engagement. We had a logo design contest. We also had a naming of the drone contest, and the drone name was called Sky Medic.
One other thing this project brought to the community was a sense of pride of being the first. First Nations communities in general are not very high on the list when it comes to medical technology. My hopes is that we are the launching pad going forward, and that we are kind of the main drone airport to supply other First Nations within our area.
There's so much more that can happen with further distances, with newer technology. It can really help rural and remote Indigenous and non-Indigenous communities.
They don't have to worry about their medication, or if something happens, they need the drone and it'll be right there. It's really awesome that, this can get out to all different people.
Thanks so much. So any questions for Jonathan?
Hi. So thanks so much. That was great, John and Sandy. Just a little background that I was sort of roped into just making some connections, but just so you know that Dana Devine was very engaged in this project, and and I know that Mike Allard and UBC Faculty of Medicine Development, I'm not sure if they're still here. Yes, they are here, have been instrumental in this project, as I understand. It's a fantastic project. I think everybody's excited about it. I do have a question about sustainability. I know you're raising funds, and if anybody wants to give, I'm sure they'll be happy to take the money. But in the longer term, will health authorities participate? Is it anticipated the First Nations will contribute to this? How do you see this in the longer term being managed? And then the second is this must go beyond healthcare. I'm sure that everybody wanting a blanket delivered from here to there will want to take advantage of this sort of service in the longer term.
So just to give you a sense, the first question, the money, yes. Yeah, the sustainability portion, and also the second question was, who will own the drone? Okay, so in terms of the sustainability portion, we did some environmental scan, and we reached out to a number of projects internationally that has done similar work, just to learn from what they found was important in terms of scaling, was important in terms of sustainability. So one group that we reached out was called Village Reach, and they've done a lot of work in Mozambique, Rwanda, and a number of other groups, Ghana, I think. And what they have found in terms of their findings is that drone is not really restricted to just healthcare. And when it comes to the economies of scale for this technology, it becomes challenging when you limit it to healthcare. And so back to kind of our core values, this is why economic development and local economic development is very important for us. One important factor to what we heard from communities is they want to be, have the capacity for economic development, for capacity for them to be drone providers. And so we have that in mind as we're building this out. And then why we bring in these different partners, including the ministry, including the health authorities, is to identify what are these metrics from a public policy perspective to make the right decision, to inform them around their policy decisions and program allocations. And then the evaluation work that we do is tailored towards building out those metrics to help inform those decisions following. Yeah, anything to add? Yeah.
No, I think Sandy said it well. The cross-section, other disciplines, certainly in our province, forestry is a massive contributor to our GDP. Mining, fisheries and oceans. The communities themselves have other use cases for the drone, such as search and rescue and the like, and surveying their territory. So I think to Sandy's point, it's around economies of scale and diversifying the use of the drone. And just for interest, as far as we know, this is the longest running drone program. We hope to be a program in the country. And that's also, I think, the secret in the sauce is to continue a longitudinal journey and not lose momentum with this work, and continue to build through successive phases of the work to become. I really believe our country has the ability to really be world leaders in rural healthcare, remote healthcare in this context. We recently did a piece on the current with Matt Galloway and the transplant surgeon from Toronto and myself. And it's very interesting understanding that juxtaposition between the needs to move an organ in the GTA versus trying to get something to tackle it, and what's the difference and what needs to be considered. So that's of interest. Yeah, because you're flying over trees, and the other people are just flying over people, and yeah. Mm-hmm. Anyway, question.
It's very interesting. What is the cost to buy that drone?
Yeah, so I think right now the main cost to our project is the drone cost is, the drone's not cheap at this point. As you can imagine, not a lot of people are buying drones this size. And so from our procurement, this drone costs close to $400K right now. Each year, these drone costs come down because it's a cutting-edge technology. Insurance, we cannot insure this technology, so we need buffer funds in case this drone crash or we lose a drone, whatever it is. Furthermore, because a lot of this requires us to move the dial forward with Transport Canada regulation in rural spaces where there's no connectivity, R&D ends up being a major cost of our project, where we are investing a lot into engineers, sensor devices, and all these things to have the right metrics to show to transport it's safe for us to do this work. Yeah, so once we're able to overcome those challenges, then it would be applicable to wildfire management, to forestry, and all those other areas. Yeah.
Okay. Yeah, I'll ask a question. Yeah. So a fantastic project. Well, really amazing work, and I'm wondering now with a drone transport to deliver goods. Typically, one of the great things about that is you're a little bit more tolerant of failures. Like if there's bad weather, the crashes. At least we're only delivering goods and not human beings here. I'm wondering, based on the flights you've done, what are the sort of rates of failure that you observe, and also what are the rates of failure that you're likely willing to tolerate in sort of the sustainable future?
So based on our 12 months of operation, 14 to 16 flights a day for 5 days a week, we had no crashes in phase 1. And I think part of that is also because at the time we were operating in fairly strict kind of operations where if the conditions are not optimal, we were not able to operate. I think with time, as we're able to proceed and do more data, we would likely be expanding those metrics where, the weather constraints, the visibility constraints, those type of things are stretched to further limits, so then we can reach more remote communities. So I don't have an exact answer for you. I hope that helps.
Yeah, I'll just add a notable. We mentioned the regulators play a big part in the story, and when we started this project. When the drone took off from one of those communities, we actually had a person midway down the lake to watch the drone go by. So that was the true story. It's the policy of Transport Canada, and by bringing them into the project, we were able to get a certificate to go beyond visual line of sight. And so, knowing the goal is to go much further, as we said, it can't put people on mountaintops to watch drones go by. That is now the policy of Transport Canada. So this project helped change national policy on drone flying in particular for rural communities. So that's a huge advancement, and there's a lot of we need to liberate ourselves a fair bit with respect to regulation in order to put blood on a drone and send it to a patient who's in need. So it seems like really easy. And it should be easier than it is, but I think we all know that these things are a bit more tricky.
Yeah, congratulations on the great work, because you guys are really leading the way in BC, and I know Dana was very keen on it. And so I think drones are going to be a big part of medical infrastructure going forward, and what. Coming out of the Ukraine, I mean, they're transporting blood and medical supplies by drone, and as well as, unfortunately, killing people with drones, and it's really changed the way. And you can see how the technology is evolving so quickly with long range over the horizon type drones. And and I think one thing is, and I've been involved in, blood stability, looking at parachuting blood and stuff like this, and. It's always remarkable. It's like, well, they want to do a study every time you want to put it on a different platform. And, blood during the Second World War, it was parachuted in wicker baskets. And, we've been doing things with blood for a long time. And, I think all the studies are going to be done and show it's just get it on the drone. It's not like any other, it's just the same as any other medical product being shipped. So I think this is a real way forward. And I think, getting through all the regulatory hurdles are important to sort out, and but I really believe this program is going to get there, and you'll be transporting blood and around the province, and probably leading into other provincial jurisdictions getting involved. So congratulations.
Thanks so much.
Thank you. Thanks, everyone.